Hello everyone, happy Sunday. So today in this session we are going to talk about menopause and hormonal imbalance with two amazing women, Grace and Dr. Michelle. So I'm going to invite them and we will start the session. So let me just... It should arrive soon. And yes. It's not working. Yes, please. It's not working. I said that Dr. Michelle is here. Let me try. Maybe Dr. Michelle, you can send me an invite if you want to join.
Hello.
So now we need
Can you see
Dr.
me?
Michelle. Yeah, perfect. She should arrive soon. Perfect. We are all in. Hi.
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 Hi everyone.
Hello.
Today we are going to talk about an amazing topic, menopause and hormonal imbalance. So maybe we can start with a quick introduction. So maybe Dr. Michelle, you can introduce what you are doing, and then after Grace, the same way, and then we start the discussion.
Okay, sure. So welcome everyone. I'm Michelle. Actually, I'm a registered Chinese medicine practitioner based in Hong Kong. So currently, I practice at the holistic medical center called Balance House. So mainly, what I'm doing every day is I'm meeting different kinds of people and then coming to us to seek help from Chinese medicine. And also, women health is one of my major interests. So actually, I keep on working with different women patients and also taking care of their any concerns about it.
Okay, great, amazing. Grace, maybe you want to quickly introduce yourself too?
Hi, I'm Grace Lam. I'm a fashion director and former senior fashion editor of Vogue China. I'm part of this talk because I'm going through perimenopause myself. I'm 49 years old, and I just want to share my experiences with the audience. So I
That's
feel like
amazing.
this topic, this topic is not so much talk in public, and I really want to shine a light onto it and tell women that it's okay to have this conversation in public.
It's true, totally true. I agree. I'm 30, and like even like throughout our years, like whether it could be hormonal imbalance or menopause or everything, I think we need to talk about it, and we need to be aware also of everything. So that's why I'm really happy to be a part of this discussion too. So I know that you maybe prepare some question for Dr. Michel, so we can maybe start with your question, and then after I will have also some question about hormonal imbalance. So yeah, Grace, maybe you can start
Yes,
if you want.
I started experiencing perimenopause the minute I hit 48, which was last year, and I started having very irregular period, and before it was very spot on every month. And I spoke to my mom about it, and before I left Hong Kong, I'm in Australia, in Perth. I'm living in Perth right now, and I spoke to my Chinese doctor in Hong Kong, and he said, actually, with some women, it follows your mom's pattern. So I called my mom, and I said, when did you go through the same, the same stage, same phase of your life? She said 48. I was like, oh my God, this is kind of freaky. And then And then I started, I found a really good Chinese doctor here in Perth, and she helped me to regulate my period again, which is great. But now my period pattern is like every 3 months, mostly every 3 months. And I realized how my body have changed. Like my abdominal area has gained weight easily. And at one point, I can't even tell the difference whether it was perimenopause or is it COVID, because I was like stuffing myself so much during the past few years. So it was hard to tell, but then I know that I'm going through perimenopause because now I'm having period like every 3 months. And last month I had it twice in 1 month, So at the beginning I was like, yay, no more period. But now I'm kind of like, maybe it's not such a good thing to have it, to end it so soon. So what's your tips about gaining weight and, to make it a bit easier?
So you also mentioned about actually the irregular cycle of the menstruation. Actually, the first sign you spotted, like, am I going through this premenopause stage? And speaking of the weight gaining, is part of like because our hormonal levels drops during the process of the premenopause and also the menopause stage, and this very rapidly dropping, causing like very strong influence to your metabolism. So and then begin with the weight gaining. And you also mentioned about one thing particularly, it's more on your abdominal region, right? Like maybe your forelimbs are still like kind of like same, but just the belly part is the major one.
I'm like the Michelin man.
Yeah, so I'd also want to explain it, like why is this part besides like other parts more obvious. So for Chinese medicine understanding, so when we coming into the menopause or premenopause stage, so actually some of the organ functions also continue with a little bit dropping in their performances. For example, the spleen, which is represent our digestive system. So spleen actually help us to regulating all the digestion and also the water like circulation inside of our body. So if the spleen function is kind of like not so strong as before, it will easier to track something here. So maybe like even though you spotted like some fat here, but actually some of the time if when we take into look at it, we will say maybe part of them actually is some kind of watery things. It's not really the fat. Yes. So it's definitely related with your spleen function. So our most of the time, our direction to help with this kind of weight gaining, we will try to support your digestive system, which means support the spleen function. Yeah. So this is the way we can do. And also, I'm thinking about one thing because this big change in the weight, because maybe before you would notice like it was easier to lose it by exercise, or you just go on some diet and then it will be easily gone. But since the metabolic rate become like low and decreased, so you will also notice it will be much harder than before. Yeah.
Yes,
So
definitely.
and then so I think there's also one thing we also need to be, I would say, just be more gentle to the change of your body, because menopause actually is a very natural process. Everyone need to go through this pathway, right? So I think initially, definitely many struggles. Like you will notice, oh, why my body like this? Like I don't really want it. But this kind of thoughts, actually, you may not notice, but you already kind of like fight yourself. It's like you kind of like build up something you don't like your body, or you just, so actually this kind of thoughts, they will also add on a lot of pressure, and this pressure will also make your metabolic rate cannot be like increased, they will also dropped. So that's why I think that you also need to kind of like create a space, like like my body right now, maybe it takes longer time than before, so I can wait a little bit. I don't really need to go very rush or rather tough on myself. It's just like I accept this natural way, but in between I also find some solutions to help myself like coping more comfortable. Yeah.
Yeah. So is there a link between, I realized that as soon as I hit 48 last year, and then I had a blood test done, and is there a link between losing iron, like an iron decrease in the body with menopause? Because I realized that my iron level has dropped dramatically, which means I have to take iron pills right now to balance my body, which never happened before because I had an intense body check before I left Hong Kong in 2019, and everything was fine. So how and has that got to do with not sleeping well as well?
Okay, so I think the iron level is also partly related with our blood, because in Chinese medicine we're always talking about the blood, because we think actually women's body counts on blood. So you need to have very sufficient supply of the blood. So actually they can maintain very regular cycle and also the function of different organs. So I think the iron like depletion is a sign like actually the blood, the elements actually is not enough than before. Like you would notice like you would easier to, I won't call it lost blood because you are not bleeding. It's just like in Chinese medicine concept, we think this element in your body is not strong than before, because we also believe during the premenopause stage, the yin energy, yin and yang, the yin energy also decreased a lot. And we think yin deficiency is actually one of the big reason causing all the menopause symptoms, because yin actually represent for the nourishment power in our body, which is the blood. Blood actually help us to nourishment different organs. So if this kind of nourishment gradually decreased or not enough, and then developing a lot of different symptoms, like for example, you spot this iron depletion, or even the sleeping interruption also can be related with the yin deficiency. Yeah.
Has this because I'm not like a deep sleeper anyway, but I've noticed that I go through cycles of like maybe 2 weeks I'll sleep really well, and especially after I exercise, and then there'll be days when I can't get to sleep, and then in the middle of the night I'll wake up. Has that got to do with a lot of like glucose increase during nighttime? I know for a lot of women it's very common for glucose level to rise during the night. That's why they get woken up and all that and stuff. And the sleeping thing is kind of tricky because sometimes it's easy, and then I go through phases of not getting enough sleep, and of course then it means you can't do anything the next day, and then you get cranky, and then I have to go with my husband, and then stuff like that.
Yeah.
It just kind of like snowball into like an even bigger problem. It's not just about you not sleeping.
I think the glucose level could be one of the reasons, because if the glucose level quite high when you're sleeping, it will definitely still keep you awake, because the insulin will like wanted to help to like drop this glucose level, right? So you would stay the conscious. But this I would say it's not just for women, like maybe other people like men, they can also have these similar things. But I would say for, especially if it's during premenopause stage, you start to have developing this kind of like sleep interruption. It's partly because we believe, if like I explained earlier, the yin deficiency, because yin is also the power to kind of like our governance at the night. So our sleeping actually is strongly related with the yin energy. You can imagine if the yin energy is not strong enough, the yin and yang, they always need to stay in a very balanced relationship. So if the yin part, like the water part, is like smaller, like not strong, then another one, the yang, it could be obvious than before. So why you stay conscious, or you cannot stay calm, stay deep the sleeping, because the yang kind of like pop up in between, because the yin cannot hold the enough power to balance with the yang, and then the yang start to kind of like wake you up. And one more thing is like there may be some of the people, because the yin is not enough, so you can imagine your body is lacking of water, which means living quite dry, or maybe with some heat and even the fire feeling. This also explains some people easier to have this hot flushes or night sweat. This also very common in menopause, because like you can imagine your body is just like very dry with some heat, because the water is not enough. And this heat will definitely influence your sleeping. You cannot fall asleep because you don't have the water power to calm you down. Yeah.
So I'm actually the one of the few lucky ones for it. I haven't got my hot flashes yet, but I'm just kind of waiting for that bomb to drop. Because all my girlfriends are like, oh, it's a nightmare. Da, 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 da. I'm just like, oh my God, I can't. I'm just like, like tick the clock. Is there any way beforehand you can like kind of get yourself prepared for that hot flashes? Because I'm scared.
So, yeah. So I would say, although hot flushes is very common symptoms, one of them, but there are also some people they don't even have that. So yeah,
Please
so
let it be
everyone.
me.
Yes, but just like you said, you also want something like you want to help, like kind of like preparation for these things, right? So I think I just come up very a simple way, kind of like a maintenance. So have you ever heard of we have some acupressure exercise, like except like you going through acupuncture is like you need to visit acupuncturist, but the acupressure actually you can do it by yourself. So actually I'd like to introduce one meridian point for you, so you can kind of like practice, because you can do it every other day at night before you go to the bed. So this, because I will later I will show you the picture how we locate the spot, because this meridian point is very special. It's called SP6, and the location of that actually is a joint point for 3 meridians, and these 3 meridians, they all belongs to the yin meridians. So that's why this point we would say it's very beneficial for women's health, even though you're not like premenopause stage, just before you want to maintain your organ functioning or maintain a good health, you can also do this exercise. So actually, can you see this picture?
Yeah.
Yeah. So this is our ankle joint, actually. Yes. So this side is the inner side, is that of the outside, is inner ankle. So you will definitely locate a bony prominence, like you would locate your ankle joint with the bony prominence. And then when you find the prominence, you put 4 fingers like it's showed here above that. Yes, this just for help you to measure the width of how long of this. And then this point after the 4 fingers here is this one. It's called SP6. Yes.
Okay.
So this point, you can either just put a thumb at this point and do press it, like adding a little bit pressure, and do it like run into circle in maybe clockwise direction. Okay, so you can do it for at least around 1 minute like this. So every time before you go to bed, because when we're adding this pressure on it, so already start to stimulate this meridian point, and it will help you to regulating this indeficiency better than normal. Yeah. So I think it will be simple to do something like this, instead of like you really need to go for any treatments or like go for some very special diet. Yeah. So you can try with this first.
Yes. I mean, I've gone quite disciplined in the past maybe few months to try to reduce my food intake or just be a lot more careful than what I was doing before during COVID, because I was like, bored or whatever, and just like, emotionally eating, and then I came across, intermittent fasting as well. And so I started doing it. I've done a few times already, and I do like the result. But what I want to know from your point of view, is it good to do that during the whole menopausal stage, or is it more harm, more detrimental for health than benefit?
I think actually this kind of fasting is quite healthy in Chinese medicine point of view, because you not really just cut your intake of the food. You just like you measure or you control the window of intake of foods, right? And so
Yes.
for my suggestion is like, if you want to start with this kind of fasting, maybe start it slowly. So I know like most popular way is like you just eat for 8 hours and fasting for 16 hours. This one's quite popular right now. But maybe for maybe majority of people, it's a little bit hard to start in this way. You only got 8 hours to eat, right? So there will be another option, like you can try with 10 hours first. Like you eat for 10 hours and fasting for 14 hours. And maybe that will be much easier than like immediately going into very strict fasting. And then for the frequency, I would say also just gradually add up. Like maybe start with just once a week, and then you can gradually to like twice, 3 times a week, or every other day. And one more thing,
Wow.
I think, another thing is very important. Like you need to observe how your body feels when you do this kind of fasting. It's very important. So because if some people, they kind of like feel very like stressful doing this kind of fasting, it's definitely not beneficial no anymore, because it needs to be, you feel it's like you align with this kind of frequency in eating. So this is also very important. And also if some people, they have some chronic illnesses, I don't recommend them to try this kind of fasting. So better consult either the nutritionist or other professionals to try to evaluate whether you're suitable for this fasting. Yes, but I would say, yeah.
I think for me it was particularly hard because I love food and I love to eat. Like, my husband's a very good cook, and my role is like I'm only in charge of eating,
And you have to enjoy it.
Yeah, exactly. So when I first tried the first time ever, I think I just went crazy and just did like, I don't know, 18 hours. But we eat very early. I think one tip I can give to the viewers is, if you do that, try to eat like 6 o'clock, because we have a kid, right? So we eat early anyway. So so we eat at 30, so it's easier. By the time you go to bed, you wake up the next day, it's already 12 hours,
It's true.
So the first time I did it, I was like aiming for for like 24 hours, Oh my God, by like 16 hours, I think my husband was just like sweating, just eat something, because I was in such a mood. I was so moody, So I think I don't advise like to go for 24 hours the first time. It was just too much, And then what's worse was, by the maybe like 16 hours, I start stuffing myself like crazy, which is not good either, So I had to just do it gradually.
I totally agree with that. Like you need to gradually like let your body adapt to this kind of like eating. It's a new habit, actually, I would say. And you mentioned about the cravings. So about the craving, I also want to share more. Yeah, because I also notice a lot of my patients, when they like near the premenopause stage, they told me they have one concern is about the craving for sugar, especially at night.
That's me.
Especially at night, it's very hard to control because like
when you're watching Netflix, you're watching Netflix, you're like, ice cream.
Your chocolate, you're just waiting for the chocolate.
True. And they would just like find it's very hard to control this craving, and they just end up like eating a lot of like chocolates or sweets, something like that. So so they also like wanted to help with this cravings. So actually there may be one thing I want to share. Like actually craving is the sign for our body, kind of like your body wants to send some message to you. So especially craving for sugar is a sign, like actually our digestive system needs some support. Because why sugar? Because sugar is a sweet thing, right? You're craving for something sweet. And we believe our digestive system align with the taste of sweet. Like whenever we make use of some herbs, we want to strengthen our stomach, strengthen our digestive system. All of those herbs, they taste sweet because we believe this is the source, like your digestive system can get this support. So actually, when you're craving for a sweet taste thing, actually it's your digestive system trying to tell you they need some support. So actually, this message, there's nothing wrong. Actually, they're just trying to communicate. It's just like when you have the craving, you just immediately go through something and then you take it a lot, and that causes the problem. So I think it's a little trick you can try. It's just like actually, if you're craving for the sweet, you can have some of them. It's nothing wrong, but how to control the amount is the problem. So
Yes.
I always suggest you can actually buy some like the sweets or chocolate in small package, not the very big package, because that will make you hard to control. But if it's in small package, so if you know, like maybe recently for this week, you have some craving for sweet, and then you just kind of like plan for it. Maybe every day I just have 1 or 2 packs. That's enough. So you just like prepare it earlier for yourself. Like you would know, you put something, some places that you know this is today my trick for sweets, and I
Yes.
have them. That's all. No more.
That's good.
And the rest of them you just put in somewhere you cannot see. You hide them.
Yeah.
So so
Discipline.
like yeah,
Discipline.
so like more like you have this initially you intensively to control it, instead of like when you have the cravings and you immediately respond to that, and then you will have a lot. Yes. So
Yeah.
and I also heard from them that this trick is quite effective, so you can try.
Yes. Yes.
Amazing.
What's your take on, because when I speak to my mom about it, because she's going to be 80 something, 83 soon next week, and when I first talked to her about this, when it was all happening last year, she was like, oh, don't take the MTH, which means menopausal hormone treatment, because they'll cause you cancer, all that. Do you think modern medicine, I mean, obviously it has improved a lot, so is it kind of like a myth that people still have that kind of mindset, or is it medicine's got so advanced that nowadays it has decreased the risk of getting cancer because if you take that kind of hormonal treatment?
I would say like the hormonal therapy it really depends on your needs and also the severity of the symptoms, because some people, if they really have this very big deficiency in the hormone causing a lot of trouble, they really need this like hormonal like support. So I would say if this whole therapy is under observation by gynecologists or very specialized in this area, I would say it's quite safe. Like if you just going through some short term of this therapy, it's definitely safe, because those extreme case is like, I would say most of the time is maybe malpractice, like maybe not control the term to using this supplements, or like maybe just do it by themselves or something like this and causing the problem. Because normally if you actually observed by the gynecologist, nutritionist, I would say it's quite safe.
Yes.
There is
Would you?
there is any other natural way that you can maybe support? Because I know that my mom, for example, she had exactly the same thought that you when she was like, she didn't take anything. And because of that, because she heard that it would be like causing cancer and things like that. But at the same time, I remember she had someone who took it, and on the skin you can see it because you have like less, impact on the skin. So I'm just wondering, if there is a like maybe a natural way to maybe help the menopause and this transition, or I don't know, like maybe some herbs or plants or whatever.
I see.
I like it.
So I
This is
would
here in
say,
Europe have.
Yeah,
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 I would say more natural way is definitely we really with foods. Like we're counting on some foods that like can help with our like the iron deficiency, or some supplements for those hormonal related supplements, right? So I would say, because still everyone, we have different body types. It's just how Chinese medicine see human bodies. So for people, like if they're really have very obvious, for example, the spleen deficiency,
mm,
for this kind of people, we would recommend them to take some foods, for example, like the Chinese yam, because this plant actually, we believe it can both strengthen our spleen and also the kidney. And why I mentioned the kidney, because we believe kidney is the organ actually monitoring our um, cycle and also all the hormones. And then by through our aging process, the essence in the kidney actually keep dropping. So that's why in Chinese medicine we always mention about you need to tonify the kidney. You need to take something to help with that. It's because of this reason. So Chinese yam actually quite good. It's can both support your spleen and also the kidney. Yeah, and actually there are a lot of plants and they can help with
yeah,
that.
sure.
Yes,
Yeah.
so I think by diet it's definitely more natural than you
In a
take
natural way.
those. Yeah, and one more thing, I also noticed some of my patients, they they will take a lot of, for example, tofu, or like those beans, because they can some research that they can kind of like a natural
Trigger
supplements for
them.
the
Yeah,
hormone, right? But
yeah,
there's one cautious, because if you take too much of that, they will definitely have some bad consequence, because those foods not always like suitable for everyone. Because we also believe, for example, the tofu, it's also a little bit cold in the in their features, a little bit cold. So if your body actually is a little bit lack of the yang energy, lack of this warmth, if taking too much tofu actually will actually add in some like other problems. Yes. So I would say, even if it's just like something related with diet, it will be better can consult, for example, Chinese medicine practitioner. You would know more like how you can change, or like keep a good diet related, like more suitable for your body type. Yeah.
Yeah,
okay,
I
sure.
think so. I think it's all a hugely, learning curve for me because, after I realized I'm going through perimenopause, I do a lot of research, reading, talk to other people, and I found a great podcast called Hit Play Not Pause. It's from I listen on Spotify, and it's a great source of information. If you're like doing your dishes or something, you're listening to it, it's very helpful. And yeah, so it's been I think I probably have like an easier journey compared to a lot of other women, but I'm just kind of like waiting for that bomb to drop. And I think another thing I want to talk to your viewers about is, we as women, we have to educate men about this. It's not only our problem. We have to start talking about, I talk to my husband all the time about menopause, about perimenopause, and I ask him to read about it, because at the end of the day, happy wife, happy life. So it's not just our
Yeah.
problem, it's
I
a
agree.
men's problem as well, right?
Totally.
You need to talk to your boyfriend, your brothers, your dad, your husband. Everybody
That's
needs to
true.
get on board for us to normalize this.
It's true. It's totally true. I agree. I agree. And we need to, like you just mentioned the your on Spotify, the podcast. It will be great that maybe after you can share it, so we can maybe give
Yes.
the to because this is again it's a part of like this discussion. We need to be open about it, and we need to learn. Like everyone need to learn about it because like it's used to be a secret, you know, like being ashamed of saying it, or like you know, like I know that for a lot of women, and I'm not at this age, but like, you know, I'm going to be, and I will have that, and I'm really happy to have this discussion with you right now to understand it and to know also like the symptoms and what I have to do and how can I prepare for that also because I know that.
Exactly.
Yeah, so it's really, really important. Unfortunately, I think we are pretty much at the end of it. Yeah, it's 17, so we have to stop there. But if you have any question, I'm talking to everyone who's connected right now. Please don't hesitate to ask us question or to Grace or to Dr. Michelle, and we will make sure to share all our tips. And yeah, maybe like if you want to give a last tips or something like that, please don't hesitate. And if not, we will end this discussion.
Thank
So
you,
Grace,
Michelle. Thank you, everyone.
Thank you.
thank you
Thank you
so
so
much.
much.
Thank you so much.
Bye.
Thank you. Bye bye.
Let's normalize
Bye.
menopause.
Yes,
Yes,
yes, very
yes,
important.
totally.
Bye.
Bye bye.
Bye.
Just stay with us because we are going to have an amazing dance class in a few minutes. So yeah, stay on the platform and we'll see you soon. Bye bye.